What have we got from our audience here? CB says, is there any recent research to show how that IDD works? When I last looked, says CB, they couldn't find any.
Yeah, so I mean, there are studies that are out there that have investigated. There probably isn't the volume and the quantity that we would like, but there's various reasons for that. But no, there are. I mean, if you go onto the, I think it's iddtherapy.co.uk, there should be some articles on there and some studies that have been done. Some of them, one in particular was done with patients with non-specific low back pain, and that didn't have a great result,
right,
understandably, because they hadn't selected the right patients. But there's certainly some others on there which have shown good outcomes as well.
Well, I think I might have mentioned to you already, I'm trying to set up a trial myself with the help of Jerry Draper-Rody, who's been on the show, and he's coming back on again next year. Great guy to talk to about research. You must know him, I'm sure. And I'll certainly look to you for advice on how we run that trial, if not involve you in it with your own clinic. Of course, funding will be the key issue there. But I am surprised that, given that this has been around for quite a long time, principally in the States, and there are clinics over there making, making quite a lot of money, taking quite a lot of money for their patients, that somebody hasn't funded a decent trial to prove that it works.
Yeah, no, that's true. Yeah. Yeah.
Certainly. Tell what's your success rate? How many patients go away unhappy after their 20 sessions, 25 sessions? Maybe?
I would say good 70% of people have a good result. Yeah. So I always say to people, listen, this isn't a crystal ball. We can't guarantee as anybody can, but if you want to give in terms of numbers, it's let's say 3 out of 10 that might not be getting the result they would ideally hope for. But
the big selling point, though, is that it's not a knife.
It's not a knife, and all the other options are still on the table. So it's not like it's not a point of no return. Yeah.
Yeah, but then of course the patient is saying, well, if I do this and it doesn't work and I have to go for surgery, then I'm paying much more again.
Of course, and that's why you have to be honest and upfront with them about it.
Yeah.